So Jenny, firstly, tell us a bit about the Nursing Times team and your vision for the platform.
So at Nursing Times, we've got people who work for the team who are actually qualified nurses. So we've got quite a few people who work on the practice section of the magazine, which looks at clinical content. And they're obsessed with doing the right thing for our nurse readership. That means looking at improvement programs that nurses can introduce that will actually improve patient care, patient experience, patient safety. So we cover quite a lot of things around projects that nurses might have done to, for example, improve the discharge of patients on time, or to prevent falls, or to reduce hospital-acquired pressure ulcers, that kind of thing. The news section of the magazine is written by award-winning journalists, and the news tends to cover things that really matter to nurses. So that can be clinical matters, new trials, or it could be health policy, or it can be things that really matter to the nurse as a professional. News about revalidation, re-registration, pay, obviously very topical at the moment. And those are the kinds of things that our readers are obsessed by, and therefore we're obsessed by.
If I was to ask you about your relationship with the PR community, what would you say? How would you describe it?
I think it's quite good. It's a difficult magazine to actually have a relationship with PRs on, because we're not a magazine in the way that, say, some of the other ones that I've edited in my previous career have been Retail Jeweller or Professional Beauty, and the transactional relationship between the products that we might write about and what our readers want to buy is different here. Nurses, of course, do have buying power and will have some influence over products, but we don't tend to cover product stories in the same way, because our title is double-blind, peer-reviewed improvement projects that are written by nurses. So there isn't a product section, for example, in the magazine. But the PRs that we get on with best are ones that really understand that and want to really provide for our readership the things that they're interested in. So we'll have conversations about work that they might have done with a nurse, and it will be a nurse that might write that piece, and then of course it will go through the double-blind peer review process. So people who are really interested, really as obsessed as we are, about patient safety and patient experience and improving those things, enhancing those things, those are the PRs that we have a really good relationship with, because they get what we're trying to do.
If a PR has something that they want to sell into you, what should they be keeping in mind before they email or pick up the phone?
So the "sell into me" phrase just leaves me a bit cold, because I think it's a lot more collaborative than that these days. It's a conversation about, we've got this really great piece of work that we're doing with a hospital trust or a private organisation, for example, and we want to talk to you about it and make you aware of it. And we can't be aware of absolutely everything that's happening. We try and be on top of everything, but it's great to have somebody who perhaps has been doing a piece of work with a group of nurses and they want to let us know about it. So I suppose the number one thing I'm looking for is enthusiasm. I'm looking for tangible results, so no fluff. So something that actually says, this is what we've done, this is the work, and this is what it's delivered. And I also think, it's the same old thing. Great photos, they tell a story, and really guiding us through why that piece of work happened, what the involvement was of the company that PR might be representing, and what the actual benefit has been for both nurses and patients. So it's got to be really nurse specific, and it's got to be delivered to us with enthusiasm, and it's got to be with an understanding that we might not take the story as it's been delivered to us, but we will want to do something different, or maybe move it on a little bit so it's unique and different and exclusive to us, and really delivers what we're after for our nurse readership.